Bismillahirrahmanirrahim. This is lecture 8b. In this lecture, we will study the importance of differentiating between correlation and causation. What we can observe in the data in statistics is only association or correlation. We cannot observe causation in the numbers because causation has to do with underlying factors in the real world. So in this lecture, we will study how important it is to learn about the causes and how this is impossible to do from looking at the numbers alone. The methodology currently in use is to say that we guess that X causes Y, check association, and then if we see that there is a strong correlation between X and Y, we assume that X causes Y. This is a very, very defective and faulty methodology. There are many possible problems. One is that if X and Y are correlated, it may be possible that Y causes X rather than X causes Y. And it's also possible that there is a common cause. There is some other unknown factor which causes both X and Y, and this leads to a strong observed correlation, but there is no causal relationship between X and Y. So there are many possibilities for correlation. And causation is the important factor for policy, as we will see from the real world examples. For students, it's important to understand that modern statistics is blind to causality. They do not understand causality. There is no word for it, and there is no methodology to detect causality in all of the body of modern statistics developed since Fisher. Why this is so? It has a long and complex history. Chapter 2 of the Book of Why by Judah Pearl and other authors explains how this happened. And this has to do with early mistakes and confusions by Galton, Pearson, and Fisher, who were all the founders of statistics. They made mistakes in terms of confusing correlation and causation. Another important reason for these mistakes was the effects of logical positivism, which basically says that only the observable matters and the unobservables do not matter. So exactly contrary to the Quran, which says that Allazina yu'minuna bil ghaib, positivism says that we should yunkiruna bil ghaib, we should reject the unseen. So once you reject the unseen, then you cannot even talk about causes because causes are always unseen. So we will study 3 examples to show how causation matters and how this is not the same as correlation. First of these examples is from the LEAP survey of educational achievements in Punjab schools. Data from this survey and many other surveys shows that the enrollment of female children in schools are lower than the enrollment of males. So the question is, what is the cause for this observation? And one obvious hypothesis is that there are social norms which favor educating boys and are against educating girls. In the context of Pakistani culture, this seems very plausible. And if this is the cause, then the way to correct the problem is to have public campaigns and explain the importance of educating girls and try to change the mindset of the public about this. But note that the data itself can tell us nothing about whether or not this is the cause. A large-scale survey administered to the parents came up with the surprising result that the parents prefer to invest money in the education of the brightest child in their family, regardless of gender. So if whether it's male or female, whoever is the brightest child, the parents will try to educate that child. So initial hypothesis that the parents don't want to educate girls, this is false. But still it is true that males have higher enrollment. So why is this the case? Now we have to search for a new reason, a new cause. And so there is a new hypothesis that maybe the parents think that the male children are brighter, even though the females are actually brighter. So in that case, because of this misconception about the abilities of their children, they will educate males. And so this is something we can check. The survey data rejects this hypothesis because they test the child's performance in school, the parental evaluation and the teacher evaluation, and they all match. If the parent thinks the child is bright, the scores of the children are high, and the teachers also think they are bright. So it is not that the parents misjudge. This is a bit surprising because sometimes it's the case that the parents are completely uneducated and they are being asked to judge whether their child is getting a good education in English, and still they can judge correctly. And so that is what the survey shows. So again, the second possible cause, that the parents do not correctly comprehend which child is brighter, this is also false. The parents do know which children are brighter. One of the problems that positivism creates to the learning about causes is that it rejects the idea of intentions. It rejects hidden variables. Now, when we ask on a survey, the parents tell us that they want to educate the brightest children, and we find that they say that we would like to educate our girl who is the brightest, but there are no schools nearby. So the intentions of the parents are to educate the girl, but when there are no schools for girls nearby, then they send the male. So the intention and the actions are different. And so when you study why this is the case, it turns out that distance is a key variable. And this emerges from the study of the real world. When you actually go and look at what is happening, you talk to people, and this is something which cannot be done by looking at numbers alone. So here is this survey which shows that the bright blue line is the fall in enrollment as the distance to the closest school increases. So as the schools are further, the enrollment decreases. But this effect is much more dramatic for girls and much less significant for boys. So parents are willing to send male children to longer distances to schools, and they are not willing to send girl children to long distances. And so if this is the cause, if distance is the cause of the differential enrollment, then work on changing social norms would not be effective in terms of improving child improvement. And similarly, work on educating parents about the students' abilities and schools would not help, according to the second hypothesis. So the third hypothesis, which we find is confirmed by the data, would require providing security, providing secure transportation to schools, and taking care of the issues that the parents have in terms of sending their girl children long distances. So depending on which of the three causes that we considered is the cause, the remedial action, the policy would be different. But again, the data will tell us nothing about this. For the next case, we look at the discovery of causes of puerperal fever, which was a leading cause of mortality among females who had given birth. This discovery in the middle of the 19th century was made by Ignaz Semmelweis, and it was occasioned by the presence of two clinics for pregnant women, and when Ignaz got there, he saw that the rate of mortality in Clinic A was almost double that of Clinic B. So the question is why, especially because Clinics A and B were next to each other in the same and nearby buildings, and they were manned by the same staff, the same doctors, the same procedures were used. So there was no reason for this difference, for this apparent difference. So the question is to discover the cause for this difference in double mortality in one of the clinics and only half in the other. Important to understand, in the middle of 19th century, there was no germ theory of disease. There were many theories about disease regarding miasma, that is bad air, combined with poor condition of the patient. So if a patient in poor condition receives some bad air, then he or she would catch a disease. There were also the issues of balances in humors and other theories of disease, but no germ theory. So Semmelweis examines all of these theories, and he says that none of these theories can explain the differential in the clinics A and B, because the buildings are right next to each other. If there is bad air in one, there would be bad air in the other. Many other hypotheses regarding the possible differences, like one of the clinics was on the sunny side and the other was not. So maybe it's the sunshine that causes it. And that was also tested and rejected. Maybe it was diet, maybe it was some other factors having to do with hospital bed sheets. Many possible causes were examined and rejected as being explanations for the differential between the two clinics. So to find out the cause, we need to study the real world. We need to think about the possibilities. So one of the things that happened was that the clinic A, at some point, both were the same, but at some point, clinic A had been isolated for the use of medical students, mostly males, and clinic B was for females to train midwives. It was the clinic B which had the lower mortality rate. So again, the question is why. There should be no differential created by this training differences. So Semmelweis noticed that one of his colleagues was cut by a knife used in autopsy accidentally, and then he then he died from this cut, and he developed symptoms very similar to puerperal fever. So it led Semmelweis to think that if the symptoms are similar, then the cause should be the same. And so that led him to conjecture that perhaps it was the accidental cut by autopsy, so there is some material on the knife that got into his bloodstream. Based on the observation that his colleague developed puerperal fever and died after being apparently infected by materials from a dead body, Ignaz Semmelweis came up with a brilliant new hypothesis. He thought that the puerperal fever in pregnant women was caused by transfer of materials from dead bodies. When he looked at the two hospitals, there was a lot of confirming evidence. The medical students at the clinic A would do autopsies, and then they would go on to examine female patients without washing their hands. On the other hand, in the clinic B, the midwives never did autopsies and never handled dead bodies. So there was a clear-cut difference. What seems very obvious to us today was very revolutionary at that time, because there was no theory which said that there is infectious materials, and they can be transferred. There was no, in fact, it was contrary to accepted theories. Once Semmelweis came up with this hypothesis that it was the transfer of material from dead bodies that caused this puerperal fever, he was able to find many observations to confirm this hypothesis. For example, in the hospital prior to 1823, they had not allowed autopsies. When the management changed in 1823, they started for the first time to examine dead bodies, and then the mortality rate rose from 125 to 500 per 100,000 in 1823. And the differential rates in clinic A and B started when the two clinics were separated into male and female, and only the males did the autopsies. Before 1840, both sides had both types of students, and both clinics had the same rates. And in the female clinic, puerperal fever occurred at random, but it occurred in rows, which suggests that somebody who is infected, some student whose hands are infected, he is going around in sequence and examining females, and he is infecting all of those females. So all of these and many other observations confirmed the hypothesis that it was the transfer of material from dead bodies which led to puerperal fever. Note that this hypothesis is not actually correct, but even though the hypothesis is false, the use of this hypothesis led to a solution which worked very well. Semmelweis required the students to wash their hands after performing the autopsy and going to the maternity ward. And once this protocol was implemented, there was a dramatic decline in puerperal fever, and the rates in clinics A and B became equivalent, which again confirmed the hypothesis of Semmelweis. As time passed, a lot of evidence accumulated that it was not just transfer of materials from dead bodies. Other kinds of issues could lead to the same puerperal fever. For example, there was a case in which even after washing, all females in a ward with a sick woman got infected because the sick woman was the first in line. She had cancer, and when students examined her, they picked up infectious material and they transferred it to the next one in line. And so Semmelweis modified his hypothesis and said that decaying organic matter causes infections. So here we note how, because we are making a hypothesis about unobservables, we can never be sure, and we may make a guess which is half correct. And even though the guess of Semmelweis was only half correct, it led to a policy which was quite effective. And after later observations allowed him to modify the hypothesis to an improved hypothesis. The third and last case we want to discuss in this lecture about the discovery of causes concerns the Clofibrate Trials, which was an experimental drug used to lower cholesterol levels and to reduce heart attacks. Heart attacks were a major cause of death, and many experimental drugs were tried in a controlled, randomized, double-blind experiment, which was carried out over 5 years to see if they would reduce the heart attack levels. There were 8,000 subjects, and 5,000 were assigned to various drug groups, and 2,789 to the control group. And then everyone was given different types of drugs, and the control group was given the placebo, which was a capsule just like the drugs, and the patients were followed for 5 years to see which of the drugs lowered heart attack rates. Initial examination of the results was very disappointing to the doctors because in the control group there were 21 deaths over the 5-year period, 21%, and there were 20% deaths in the treatment group. So the difference was insignificant. So the conclusion is that clofibrate does not save lives. However, the record showed that clofibrate does lower cholesterol, and so there was a puzzle. How can the drug lower cholesterol and still not lower the heart attack rate? So the physicians who were looking at this study decided to make a deeper study of the data. So here's a table of the results from the Clofibrate trials. If you look at the total deaths in the control group, that's 21%, and in the Clofibrate group it is 20%, and this difference is not significant. But if you look within the Clofibrate, the doctors thought that maybe some people took the drug and some people did not, and that was the cause, because they could not control. They prescribed the drug, but people chose whether or not to take the drug. So they calculated that they classified the people in the treatment group into two types. One was the people who took 80% or more of the tablets, and these were called the adherers, and the others did not take the tablet often. They were very careless and sloppy about the drug. So when you look at these numbers, then among the people who took the drug regularly, the deaths were 15%. Among those who did not, the deaths were 25%. So there's a 10% gap, and this suggests that the drug is indeed effective. So there was some possibility that maybe the drug is effective but did not show the results because the people who were in the treatment group did not take the drug. So is this logic reliable? Can we conclude that clofibrate does work as long as you take it? Well, you have to examine the groups, adherers and non-adherers, and ask, are these two groups matched on the relevant factors? These groups were not chosen at random, so they are not guaranteed to be matched. Within the treatment group, some of the patients chose to take the drugs regularly and others did not. So there is one difference between groups of the adherers and non-adherers. One of them are more health conscious and they are regular about their drugs. Maybe they are regular about exercise, maybe they are regular on other factors, diet, while the non-adherers are careless about the drugs and they are also careless about their health. So maybe the difference between the two groups was not due to the drug, but was due to the habits of the people. So now it turns out that if you look at the heart attack rates, the same difference between the adherers and the non-adherers occurs in the control group as well, where even the adherers were taking the placebo and they were not actually getting the drug, but still in the control group there was only 15% deaths, and in the among the adherers, the people who took the dummy drug, the placebo, and among the non-adherers, the people who were sloppy about taking the dummy drug, the deaths were 25%. So it seems that it is not the drug that caused the lower heart attack rate in the Clofibrate trials. It was just the health consciousness of the people in the adherers group. So in fact, the randomized control trial gives us the right result that the Clofibrate does not work. So what we conclude from this is that the randomized control trials gives us the right result about the drug, and the observational study gives us the wrong result. If we look at just the adherers and non-adherers, the people who took the drug, we make the treatment group the people who regularly took the drug, and the control group the people who did not take the drug regularly. Then these two groups are not matched on all relevant factors, and there is a confounding factor which is health consciousness, and it's this confounding factor, health consciousness, which causes the difference in the results. So what we are trying to show here is that the finding out the cause of what happens requires probing deeper into what is happening in the real world. You cannot stop at looking at the numbers and attempt to find the causes. And the numbers can event lies, because if you just look at the numbers, you can conclude that, look, Clofibrate prevented 10% of the deaths. And if you have commitment to a theory, that is lowering cholesterol must reduce heart attacks, then it can blind you to the reality and you can come to the wrong conclusions easily. So to conclude this lecture, we note that causes do not lie on the surface. They cannot be deduced from the numbers alone. In fact, you have to probe into the structure of reality. The observations we see tell us about the correlations, the associations between two variables, but they do not reveal the causes. And in order to learn the causes, we must know more about the real world processes which generate the data, and we need to know about the underlying and unobservable mechanisms by which the world operates. For example, the transference of germs from one person to the other. So we need theories to learn about causes. Just studying the data is not enough, never enough to reveal the causes.